Hello everyone, welcome back to my channel Mis.Medicine, and this is the previous year questions of Haryana medical officers, which is HMO. So let's start. This is 2020 PYQs set A. The first question is, which one of the following muscle prevents lateral displacement of patella during extension at the knee joint? The answer is vastus medialis. The next question is, a tuft of the hair on the back of a newborn is likely to be associated with spina bifida occulta. Next question is, a lesion of left hypoglossal nerve causes deviation of tongue to the left on protrusion. Next question, violent inversion of foot will lead to avulsion of the tendon of which of the following muscle attached to the tuberosity of the fifth metatarsal is peroneus brevis. Next question, the sickle cell anemia results because of a defect in which of the following chain is beta chain? This is the easy question. Parahemophilia is due to deficiency of factor 5. Next question is, in brain ischemia, systemic blood pressure rises, which is called Cushing reflex. Next question, which end product of citric acid cycle is used in detoxification of ammonia in brain is alpha ketoglutarate. Next question, a person on a fat-free carbohydrate-rich diet continues to grow obese. Which one of the following lipoproteins density lipoprotein? So the next question is, which one of the following organs does not utilize ketone bodies is liver? These are the biochemistry questions. Next question, which one of the following drug is used for rapid symptomatic relief of urinary symptoms in benign prostatic hypertrophy is tamsulosin. This is the drug of choice. And all of the following drugs reduce mortality in patients of congestive cardiac failure except furosemide. Next question, which one of the following tumors occurs due to radiation exposure is papillary carcinoma of the thyroid? An adult patient has presented to the OPD with symptoms presumptive of pulmonary tuberculosis. According to the RNTCP, the first diagnostic step to be taken is smear for AFB and the chest X-ray. Next question, as per the CDC criteria, which one of the following is not a notifiable disease is streptococcal toxic shock syndrome? Next question, first dose of Next question is, first dose of PEP for HIV should be taken not later than 72 hours. Within 72 hours, we should take prophylactical dose. Next question, for doing gastric lavage, the length of the stomach tube that is introduced is 50 centimeter. Paltaf's hemorrhage are seen in lungs. Next question, after coitus, motile sperms can be detected in vaginal aspirate for a period of 6 to 12 hours. Next question is this is not a question, but these are the some epidural and subdural hemorrhage images. And there is semen parameter according to the WHO criteria 2010 and 2020. So semen volume should be, and it can be asked in this year also, so it can be possible chances. Semen volume 2010, that was 1.5 ml, now is 1.4 ml. Serum concentration is 15 million per ml and now is 16 million ml. Total mortality is 40%, now according to the new rules is 42%. Progressive mortality, updated one is a 30%, viability 54%, and morphology, which is same as the previous one, is 4%. It can be asked many times. FMG में भी क्वेश्चन पूछा गया है और नीट पीजी में भी पूछा गया है. Next question is, extradural hemorrhage is commonly caused by the damage to middle meningeal artery. Next question, roving ring scotoma is seen in aphakic classes. Next question, aqueous humor is secreted by ciliary body epithelium. Next question, brain fungus is the term used for the herniation of brain into mastoid cavity. Fungus cerebri, which is a protrusion of the brain and the dura out of the cranial cavity into the mastoid and the middle ear. Next question, in diphtheria treatment, dose of the antidiphtheric serum is dependent on the duration of illness. Next question, term adenoid faces does not include high cheekbones. Next question, under home based newborn care, number of visits made by Asha in case of home delivery up to 42 days is 7. If it is home delivery, then 7 visits, institutional delivery, then 6 visits on the day of 3, 7, 14, 21, 28, and 42 day. And if it is cesarean, then 5 visits. क्योंकि थर्ड डे तक तो पेशेंट हॉस्पिटल में एडमिट रहता है. सो next question, in India, anti-malaria month is observed every year in the month of June. Next question is, daily requirement of iodine for an adult is 150 microgram, and for the magnesium is 340 milligram per day, and for the iodine we already discussed 150 microgram per day. Next question, arrange the following in a descending order of their carbohydrate content. So first one sugar, second one jaggery, third one potato, and the fourth one is the rice. Next question, which one of the following disease is transmitted by pubic lice? से जो transmit होती है, there is none of the above is the answer, because pubic lice cause only pruritus. There is no disease transmitted. So, epidemic typhus, which is spread by Rickettsia prowazaki, relapsing fever caused by the Borrelia recurrentis, and trench fever caused by the Bartonella quintana. So, the answer is none of the above. Next question, which one of the following is not a primary prevention? Self breast examination for the tumor is not a primary prevention. Next question, the best indicator for availability, utilization, and effectiveness of healthcare service in the country is infant mortality rate. नेक्स्ट क्वेश्चन, डेल्फी मेथड इज अ मेथड ऑफ कम्युनिकेशन. ये सारे पीएसएम के क्वेश्चन है, सो मस्ट डू पीएसएम फॉर हरियाणा एमओ एग्जाम. नेक्स्ट क्वेश्चन, ब्रेस्ट मिल्क कैन बी स्टोर्ड इन रेफ्रिजरेटर विदाउट स्पॉइलिंग अप टू 4 days. Next question, following are the beneficiary of weekly iron and folic acid supplementation for prevention of anemia under revised strategy of iron plus initiative, except children 6 months to 5 years of age is not in the strategy of the anemia prevention, is not included. So the next one is Nikshe, is a code based web IT system used for the surveillance of tuberculosis. The next question is, the program strategy under National Viral Hepatitis Control Program includes the following except immunization against hepatitis A. But National Viral Hepatitis Control Program, which is NVHCP, includes hepatitis B, their immunization, diagnosis and treatment of the hepatitis B, and the diagnosis and the treatment of hepatitis C, but not hepatitis A. Next question, following diseases are included under National Vector-Borne Diseases Control Program except is the yellow fever, but under NVBDC program it includes filariasis, leishmaniasis and dengue fever, but not yellow fever. So here are the some lists I will show you. Yeah. The international health regulation includes cholera, plague, yellow fever, SARS, smallpox, influenza and wild polio, and in the international surveillance it includes polio, rabies, relapsing fever, louse-borne typhus, influenza, malaria and salmonellosis. And for the tropical diseases which comes under training research is malaria, filariasis, leprosy, leishmaniasis, trypanosomiasis, schistosomiasis. And for the quarantine which need quarantine, the diseases are the infections are diphtheria, TB, plague, smallpox, yellow fever, SARS, and viral hemorrhagic fever. They all need quarantine. And the next question is, first referral unit should have the minimum of the following facility except is the specialist medical care, because first referral unit include obstetric surgery, specialist pediatric care and a blood transfusion. It should be there, but specialist medical care is not there. So next question, with the following with the government of India committed to achieve the sustainable development goal of the ending tuberculosis by 2025, the revised National Tuberculosis Control Program has been renamed as National Tuberculosis Elimination Program, NTEP, And the next question, open vial policy under the National Immunization Program is not applicable to the following vaccines except hepatitis B vaccine. But open vial policy applicable for is not applicable to the following except, okay, it's applicable only to the hepatitis B, but it's not applicable to the BCG vaccine, JE vaccine. Next question, what is the main objective of Janani Suraksha Yojana, which is an activity under National Family Welfare Program to reduce maternal and neonatal mortality? Next question, sweating is absent in which of the following heat syndrome? Is the classic heat syndrome. Next question is, harmful effects are well documented with the high doses of which of the following vitamins except biotin? Harmful effects documented with the high doses of which vitamins? Vitamin A, C, and D. Vitamin C people use of so oftenly nowadays as a skin care. So, and vitamin D, mostly patients have vitamin D deficiency. I have seen many patients in the daily routine, they have vitamin D and vitamin B12 deficiency, and then they have the symptoms of body ache, weakness, lethargic, and so on. So next question, all of the following substances are poorly absorbed by activated charcoal except benzodiazepines? BZD. Next question is, which of the following first aid measures is the only one recommended now in the field to limit snake and venomation? Is the immobilization of the bitten extremity. We shouldn't have to like mobilize the bitten extremity. अगर हम पेशेंट की एक्सट्रीमिटी को हिलाते हैं, वी हैव टू स्टेबल इट. अगर हम उसको मतलब पेशेंट को कहते हैं वॉक करने के लिए या कुछ भी कट मूवमेंट होती है तो इट कैन स्प्रेड, द विनोम कैन स्प्रेड टू द होल बॉडी. नेक्स्ट क्वेश्चन, which is open vial policy not applicable for the, we already discussed about it, BCG, Japanese encephalitis, measles, MR, and rotavirus, but it is applicable for the DPT, TT, pentavalent hepatitis B, PCV, IPV, and OPV. Okay, so the next question is, associate the type of crisis in sickle cell anemia with the clinical conditions against it. And first one is the, we have to match the column here. First one is the aplastic crisis, which is low reticulocyte count and the parvovirus P19 reaction. We have seen parvovirus P19 infection with the aplastic crisis. This is the PYQ. And vaso-occlusive crisis, clinical conditions include severe pain, tissue damage, and the necrosis. And hemolytic crisis, this explains its own, like decreased hemoglobin, hematocrit, high reticulocyte count, and jaundice. These both can like matching, and then you can match another one also. So next is the, out of the following, the best vein for the total parental nutrition is subclavian vein. And 49th question is, chronic vomiting leads to all of the following except metabolic acidosis, but chronic vomiting leads to hyponatremia, metabolic alkalosis, hypokalemia, and the treatment will be NS. Next question, what is the content of sodium in ringal lactate is 130 milliequivalent. And in the NS we have sodium and chloride. Sodium is 140 milliequivalent per liter and chloride also 154 milliequivalent. Total is 308 milliequivalent. But in ringal lactate we have sodium content is 130 milliequivalent per liter, chloride 109, potassium 4.5, calcium 2.7, and the lactate is 28. Okay, the next question is, in which of the following infections the rash spread from the hairline downwards? Is the measles. Next question is, in the classification of wounds, class 3 wound is contaminated. This is the surgery question. Don't skip these 5 like subjects: PSM, surgery, or PGY, medicine, and pediatrics. These 5 subjects are must. Others you can skip, because I think last time it was 60 percentage, like 60% it should be for the like taking the vacancy. You can get the vacant seat if you have 60 marks out of 100 and there is no negative marking. Okay, so the next question is, which one of the following is the most common cause of radiolucent urinary calculus? Is uric acid. And there are radio opaque stones which They are calcium oxalate, cysteine, and struvite, which is CCS. And next question is most common indication of circumcision is request for the cultural reasons. And here are the type of surgery, which are the wound classification. Clean surgery class 1, clean contaminated surgery class 2, contaminated surgery class 3, and dirty surgery is class 4, which have infection up to 40% without any prophylaxis, and with the prophylaxis it's 7%. In class 1 it includes heart, brain, joint transplant surgery, herniorrhaphy and swelling excision. Class 2 contains wound of bowel, biliary and pancreatic surgery, gastrojejunostomy. And class 3 include like examples appendiceal abscess, perirectal abscess, drainage, infected laceration and diverticulitis. And class 4 it is includes like examples are like worst wound, acute cholecystitis with the spillage of pus from the gallbladder, traumatic wound, and bowel obstruction with the enterotomy and the spillage of the content. And the next question is obstructive jaundice does not include raised urinary urobilinogen. Most common type of intussusception is ileocolic. Next question, a 30-year-old woman presents to doctor with fear of developing ovarian cancer. Her 70-year-old grandmother had also recently died of ovarian cancer. She is counseled about the risk factors and prevention for the ovarian cancer. Which of the following can decrease in a woman risk of the ovarian cancer is the use of OCP pills. OCP, combined oral contraceptive therapy. Next question, life threatening malformation that can be corrected in utero are all except conjoined twins. Next question, most specific marker indicative of neural tube defect is alpha fetoprotein. Daily requirement of folic acid in normal pregnant woman is 400 microgram per day. It's wrong, correct? It's wrong. Option marked here, but the answer. Next question is common cause of primary amenorrhea in a 16-year-old girl is constitutional delay. Next question, which one of the following methods of laparoscopic sterilization is associated with minimal loss of fallopian tube is Fmge clip. And the next question, drug of choice for treating a girl with the precocious puberty is GnRH analog, which includes leuprolide, goserelin, and triptorelin. Next question is amenorrhea. What is amenorrhea? Amenorrhea means absence of the menstrual bleeding. It can be transient, intermittent, or permanent condition. There are two types, primary or secondary. Primary means no menses by the age of 16 in the presence of normal secondary sexual characters. And the presence of normal breast development confirms gonadal secretion of the estrogen and but not necessarily the presence of ovarian tissue. No menses by the age of 14 in the absence of secondary sexual characteristics and no menses within 2 years of thelarche breast development. It comes in the primary type. And in the secondary type, absence of menses for at least 6 months in a woman who were previously menstruating. Next question. If on fetal echocardiography, it is reported as congenital heart block. Then mother should be investigated for SLE, systemic lupus erythematosus. Next question, most effective therapy for the treatment of bacterial vaginosis during pregnancy is metronidazole. Which one of the following is the most common cause of diaphragmatic hernia is patency of Bogdalic foramen? Down syndrome, which is trisomy 21, have endocardial cushion defect. Turner syndrome, intellectual disability is normal, fertility decreased, and the chromosome is 45 plus XO, and it have bicuspid aortic wall and COA, which is correct. Third one is the Noonan syndrome, which have fertility normal, PTPN11 gene defect, and it like pulmonary stenosis and HOCM hypertrophic cardiomyopathy is seen in Noonan syndrome. Next question, which heart disease is associated with the Turner syndrome, which is we already discussed bicuspid aortic valve. Next question, which statement out of the following depicts action of the atrial natriuretic factor? It inhibits renin and aldosterone and increase GFR. Next question, all of the following can lead to hypernatremia dehydration except cholera. Next question. Colostrum is rich in which of the following vitamins is vitamin A? All of the following conditions will increase maintenance fluid requirement in a child except hypothyroidism. Which one of the following is a part of carnitine deficiency is cardiomyopathy? Next question. In vegan mother, breast milk is deficient in which of the following nutrients? Vitamin B12 and breast milk deficient of vitamin K. Next question. Distal interphalangeal joints of hands are common involved in psoriatic arthropathy. Next question. Milwaukee brace is used for scoliosis. March fracture is the fracture of the second metatarsal. And multiple cannonball lesions in chest x-ray is suggestive of metastasis. Next question. In which of the following conditions is typically soap bubble appearance seen on x-ray is osteoclastoma? Which one of the following is the most common tumor of the posterior cranial fossa in children is medulloblastoma? Next question for X-ray of maxillary sinus. Which one of the following is the best view is Waters view? Next question, the following is the investigation of choice for bronchiectasis is HRCT. Next question, curly B lines on PA view of the chest is seen at which of the following zones of the lungs at the base near the costophrenic angle? Next question, in which of the following conditions the typical target lesion seen is erythema multiforme? Next question, a patient with borderline tuberculoid leprosy develops sudden onset foot drop on the left side. Which one of the following nerve involvement is likely to have caused this deformity is lateral popliteal nerve. Next question, the vaginal epithelial cells that are covered with the Gardnerella vaginalis are known by the name of the clue cells. Next question, which one of the following structures in females is resistant to gonococcal infection is vagina? 87th question, ideal water seal for intercostal drainage should be 1 inch. 88th question, ventilatory mode not used in sleep apnea hypopnea syndrome is high frequency jet ventilation. Next question, in which of the following condition is hemoptysis not seen in emphysema? Question number 90, chronic obstructive pulmonary disease which is COPD includes all except bronchial asthma. Next question, airborne precautions are followed for all of the following except MRSA. Next question, transmission risk for needle stick injury is highest for the hepatitis B and next for the HIV. Hepatitis B, if it is vertical transmission 90%, needle stick injury 30% and eye splash 0.3%. In the case of HIV, vertical transmission 30% chances, needle stick injury 0.3% and eye splashes 0.1%. Next question 93. The most sensitive indicator of fecal contamination is thermotolerant E. coli. Next question 94th. For which of the following organism does the vaccine strain needs to be changed annually to adjust with the seasonal variation is influenza? Next question, the World Hand Hygiene Day is celebrated every year on 5th May. Next question, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana was launched in the which of the following year is 2018. 97th question, who among the following is credited as father of antiseptic surgery is Joseph Lister? 98th question, as per the biomedical waste management rules 2016, the color coding for disposable of the contaminated recycle. Next question, the International Committee of Taxonomy of Viruses has officially decided to designate the causative organism for COVID-19 as SARS-CoV-2. Next and the last question, which of the following is not a drug of choice for ascariasis is metronidazole? Thank you for watching. Bye bye. Take care. All the best.